Germany 啊，是从德国来的科隆大学的这个欧洲体育发展休闲研究院的院长啊，也是博士生导师。他的主要的学术研究领域呢是这个体育政策和研究、体育治理和体育史。米塔格教授呢来给我们做一个报告。好，现在欢迎米塔格教授。
Okay, ni hao. Good morning.
Good morning.
Thank you very
Very early morning, sorry.
Yeah, it's still morning over here in Germany. Thank you very much for this kind introduction. It's a very pleasing honor for me to contribute to this very distinguished forum. And I would like now to contribute in a way that I'm presenting an overview on the question of sport and health in Germany and Europe from a more social science perspective, and trying to get some insights, especially in view of empirical studies and statistical data we take from most surveys. What I'm going to offer is to show you first a more general overview on principles of health in Germany and in a more broader perspective on Europe as well. I'm going into details with some concepts and determinants of health and motivations for sport and health. I'm focusing then slightly on the particular issue of prevention, and there might be some stronger linkage with the Taiji approach as well. And finally, I'm going to introduce some more recent trends and activities, especially in view of actors and stakeholders that are relevant for the sport and health dimension in Germany. Finally, some conclusions to be drawn also in view of a comparative perspective. So if we talk about health in Germany, we have to first of all have a broader picture. There are different approaches. There's a compulsory one that is really relevant, and that is a difference to other parts of the world where we have more mandatory systems. The entire system of health in Germany is also based on solidarity of the entire population. It's based on contributions in a financial way, and it's organized largely by the people themselves, by some kind of self-administration, which nevertheless shows close linkages to the state. What I would like to highlight is the most recent principle, that is the one of prevention, that has just been introduced most recently in the last 5 years. Over here in Germany, we have a rather strong tradition of health and social security. You might be aware that we already started in the late 19th century with a mandatory health insurance, with some kind of statutory casualty insurance, and also a pension insurance. That was the former Bismarck system, which has already been invented in the 19th century. Unemployment was added, and most recently, the nursing care approach came in the late 1990s. That is our very strong and long tradition of health in Germany, but officially sport was never mentioned, physical activity was never mentioned in this overall health system. Now let me introduce you some major concepts and determinants of health. There are some clear causal links and correlations, for instance, between the socio-economic framework and the higher level of health. The higher the education, the higher the socio-economic income, the higher the health. We have another correlation. If it gets to work, if you're unemployed, then we can clearly identify a lower level of health. If you are in a healthy family relationship, if you're having a wife, a spouse, and children, then you have also a very higher level of health. Migration does not matter as far as our statistical evidence is taken into consideration. There are no difference whether you not have a migration background. And of course, no surprise, sport and physical activities, these two aspects count tremendously when it gets to the level of health. On the other hand, we are aware of risk factors, and I just want to highlight the most important risk factors that are linked to sport and physical activity. We have a high systolic blood pressure. We can identify a high body mass index, and we can also identify low physical activity with a certain percentage of a risk factor if you're not contributing to these healthy, relevant aspects. As far as the framework is concerned, we have also to mention the expenditures on health, and both from a comparative perspective, but also from a national perspective, we have very high expenditures of health in Germany. As you see from the table bottom left, we have an increasing number of expenditures in health, roughly 12.5 million euro that are spent on health. And if we compare this to the national GDP, we see also an increasing level. Most money is spent by the statutory health insurance. They do cover the most important part of the money spent on health issues. Compared to other countries, both on the left side in Europe, on the right side in a global perspective, Germany is on the top range. That means we have really high expenditures on health in an overall perspective, also compared to other OECD countries. That is the reason why health attains more and more attention, and also public agency, the government, but also the sports organization play increasing attention and awareness to the determinants that contribute to sport. If it gets to the relationship of sport participation and physical activity and health on the other hand, we have more or less 4 different actors and factors. The environment plays a role, the social framework, some societal factors as well, psychological factors, your personal well-being, your personal situation, and your relationship with others, the interpersonal factors that play a role. These 4 dimensions are duly taken into consideration when it gets to sport and physical activities. Now let me again highlight some correlations between sport participation and these 4 factors. For instance, if you have already started with an early age, in early years, and experience former activities in sport, then you have usually a positive correlation and a higher level of participation. Same if you have received already a perception of your own potential and a high level of high self-awareness, then as well you have a higher level of participation, especially in those fields where you have contributed successfully. Those fields where you haven't the same level of success, so a rather unsuccessful level, also leads to a lower level of sport participation. Especially in view of the generational aspect, the age, we have identified if you're young, the children are affected primarily by having fun practicing sport, but also by learning new skills, by making friends, the whole setting of belonging to a group. These aspects contribute substantially to the high level of sport participation. It's different when you're considering the young adults. They are much more affiliated to body care, to fitness and health. And if you take into consideration the elderly people, the older ones, then their pleasure, but also their health and recreation plays a crucial role. On the other hand, if we ask those target groups, why are they inactive? We primarily identify a lack of time, a lack of motivation and energy, but also purely having no interest in being active in sport. These are relevant aspects. So once again, we have to distinguish between more internal and more external stimuli when it gets to the question whether you're active in sport or whether you're not active. Considering the internal factors, the interpersonal factors, I again want to highlight the relevance of the socio-economic framework. We particularly have identified this aspect during the most recent pandemic. Those people who have a higher level of education, those people who have a higher income, they also participated in sport and physical activity due to the pandemic. And that is absolutely important to realize that those who were less well educated, who have a lower income, that they stop practicing any activities during the pandemic. That is one of the most crucial explanations why sport activity decreased in pandemic, because the income and the education background, especially of the parents, played a role and had also an effect on the younger ones. So the aspect of work, the aspect of your employment framework plays an increasing role when it gets to sport participation and sport activity. If we have a closer look at the interpersonal factors of sport participation, then we again realize that gender matters. Male people usually have a higher level of participation, while female people still don't contribute that much. Whether you're in an organized setting or in an informal setting, but female people are usually less affected and less active. Age counts as well. Elderly people still show a lower level of participation, what means that you have to attract the awareness of older people in order to become physically active. If it gets to health itself, if you have already a healthy background and then contributing to a higher level of health, or the other way around, that is not clear. But of course, the background of health plays a crucial role, but it's not clear whether sport is a starting point or health is a starting point, or just the other way around. It seems that this is vice versa, a strong causal interrelation in itself. Infrastructure, again, plays a very crucial role, maybe also not that surprising. If you have a good access to facilities, if you have access to formal or informal sport settings, then you usually contribute with a higher level of sport. And also traditional aspects, some kind of past dependency in view of tradition and an already established sporting culture plays a very important role. Whenever you're used to practice any kind of sport, and if your framework, your setting has already established a sporting tradition, then we also identify a higher level of sport participation. Having said these general findings, I now want to make you familiar with some statistics considering Europe, not just Germany, but Europe as a whole. And you can see, and you can take from the graph and also from the map over there, that we have substantial differences. We have some kind of north-south and west-east gas. The northern countries are much more affiliated to sport than the southern European countries. And as well, Western Europe is more dedicated to sport than Eastern Europe. Nevertheless, we have substantial rates of people in Europe that never ever exercise any kind of physical activity or play sport. Roughly saying, 46%, and that is an even increase in the most recent years, of all European people never ever practice sport. And just another 14% just rarely or seldomly play sport or carry out physical activity. On the other hand, that means we have just 33% that are active with some regularity and 7% with regularity. These might be surprising figures, and they show that we have to take into account the high level of people, 46% in total, that never practice sport. Again, a huge gap between the countries. We have on the one hand countries whereas, for instance, Finland, Sweden, and Denmark, the northern countries, where we have high level of physical activity. At the other end of the axis, we have countries in Southeastern Europe, Bulgaria, Greece, but also Portugal in the West, where we have high proportions, high shares of people never practice sport. Physical activity is defined over here as frequency and duration, and we see again the frequency and the time that is spent are also limited to some extent. On the other hand, especially during the pandemic as well, we identify high ratios of sitting periods a day. 12% of all people spend more than 8.5 hours a day just sitting, nothing else, just sitting. And also another share of 5.5% spends a period until 8.5 hours a day on sitting. So what does this mean? What kind of challenge derive from this statistical data? First of all, to be aware that we have a huge gap within the European countries, whether it be a formal setting or whether it be an informal setting. On the left hand, the sports club, they are relevant in countries like the Netherlands and Germany, but just with a share of 20%, 23%, 27% at the highest peak. And on the other hand, we have, especially in the northern countries, in Sweden, in Denmark, but also in the UK, a high level of people that attend a health or fitness center. On the other end of the axis, you see states like Lithuania or Latvia, Bulgaria or Romania, who don't practice that much sport in sports clubs, neither in sports clubs nor in any kind of health centers. Again, raising the question, why aren't you active? Because people are suffering from time. They don't have enough time. They don't have enough motivation. Some suffer from disability or illness. For some people, it's even too expensive. Some don't like to compete in any activities. Risk of injuries and other aspects are less relevant. So time plays a crucial role and motivation plays a crucial role. What does this mean? And now I want to highlight the network and the complexity of aspects that contribute to a healthy lifestyle in view of stakeholders, especially in view of companies that are addressed with the most recent prevention approach. So we have traditional actors as sport clubs, as sport offices, as health insurances, and also foundation and politics contribute. But we can identify that the professional setting, the companies, the schools, the universities also have to play a more crucial role. Let me underline this also in view of the next slide, which distinguish between three different dimensions. The public dimension, that was already very much on the agenda. The private ones as well, the sports clubs, the sport association, where we turn more and more attention to the center, to health insurances, pharmacies, hospitals, and fitness centers. They play a more crucial role when it gets to the actors in sport. And that has been highlighted also in the most recent activities of national public agency by the government, but also by the private ones, by the sport federations and by the sport associations. In 2015, Germany has passed the most recent federal prevention law. And this kind of federal prevention law has changed the overall approach to health. There's an enhanced cooperation between the various actors. There's more nursing care, there's more vaccine prevention, and there is also some kind of national prevention strategy that contributes to a healthy lifestyle, considering health as an overall societal task. Let me conclude my presentation with some most recent activities that are carried out. What will be done in Germany and in other European countries as well, a strengthening of prevention. Non-medical prevention, especially sport, will contribute to an increasingly extent. Of course, we have to have an influence on time, on working structure, on overtime, on leisure time perspective. We have to improve the psychological factors as family plays a crucial role. We have to reduce inequalities as the social factors play a role. More money will be spent on education in order to raise people's awareness. And what finally also counts is the interpersonal linkages, the connecting of factors. And that is relevant for our overall perception of the entire problem of health and physical activity. And that is the reason why I'm happy to have contributed to your forum over here. And that's why I'm looking forward to further collaboration and cooperation. Thank you very much for listening, especially to Professor Xushin, who has contributed to our cooperation already in the previous years. And I'm looking forward to further interaction in view of these data and your personal findings and further activities as well. Thank you very much.